Ladies and gentlemen, China is one of those places where they have a high number of people that smoke. In fact, the smoking death rate is very high in China, all kinds of lung cancer. And they're saying this may actually make things worse because let's face it, if you got to smoke, you got to take that mask off out in public. So not only are you opening yourself up for the virus, it'll be easy for you to spread it if you got to constantly be out in public smoking. So this came out in Fortune, February 19th, 2020. China's high smoking rate may be exacerbating the corona outbreak. Yeah, I mean, how do you keep a mask on your face if you're outdoors smoking? And they're telling everybody to keep a mask on. You're not going to be able to do it. The death toll from the novel coronavirus outbreak has now topped 2,000. Yeah, and I bet you it's even beyond that now. But while cases have spread to at least 28 countries beyond China, the vast majority of those deaths, all but six of them, have been in mainland China. It's not surprising to some extent, given that the virus causing the respiratory illness, COVID-19, designated in China, and given the nation's highest population density, among other factors. But there may be another underlying cause behind the severity of symptoms and number of coronavirus deaths in China. The country's sky high smoking rate among men. More than 52% of Chinese males 15 and over are regular smokers, compared with just 2.7 of females. Wow, it ain't hardly any females smoking there. According to the World Health Organization, there are more than 300 million smokers in the country, which accounts for 40% of the total worldwide tobacco consumption. Wow. They consume that much tobacco in China? 300 million smokers. Damn. That's like everybody smoking in America. Chinese men make up a disproportionate share of coronavirus infections and deaths, according to several recent studies. One report found that nearly 60% of examined cases occurred in men. Others have pegged the number at anywhere between the mid to high 50s. The median age of patient ranges from about 45 years to 56 years, depending on the report. A new review of infections published Monday also found a disparity in death rate. Among men, the coronavirus have a 2.8 fatality rate. For women, the number was 1.7%. I don't know. What are they saying? That many of these deaths are associated with men in China that smoke? It could be possible. While there are multiple risk factors for coronavirus infection, medical experts told Fortune that smoking may also be fueling the asymmetric number of COVID-19 deaths in men. Smoking could potentially make someone both more susceptible to infection and less able to fight it off, given the medical condition associated with tobacco use. There are three possible ways that smoking may be driving these disparities. Dr. Peter Hotez, Dean for the National School of Tropical Medicine at Houston Baylor College of Medicine, said patients with hypertension or heart disease associated with smoking appear more susceptible to the virus. Smokers are more prone to contracting the flu and the coronavirus. Actually, that makes sense. infection can occur simultaneously with influenza. Wow. So you can get the coronavirus and a flu? And there is growing evidence that a key biological marker that the current coronavirus strain binds to is far more prevalent in smokers than in non smokers. The question is whether smoking has a direct impact on the coronavirus, said Hotez. And preliminary evidence suggests that may be the case. Interesting, but definitely believable, y'all. A biological marker or biomarker is simply put an indicator of some kind that can be measured in biological samples like blood work that would show something abnormal like an infection. A study published last week by the University of South Carolina researchers support the thesis that smoking is linked with a higher amount of the biomarker associated with coronavirus infection. Wow. You got to think if over 50% of the men in China, or 300 million people in China, are smokers and they are more open to getting the coronavirus and dying from it, that is pretty scary. That would just change the entire dynamic of the population in China if this thing continues to grow. That's pretty significant right there. Wow. Viruses bind to specific receptors. And in the case of coronavirus, ACE2 is a key target. ACE2 is more prevalent in the lower part of the respiratory tract. It's more prevalent in men than in women, and it's more prevalent in smokers. Albert Rizzo, chief medical officer for the American Lung Association, said, if you're older, have bad lungs, smoke, you're not going to fare well with the coronavirus. Wow. Yeah, I could see how it would be deadly to a person like that. There was also, so there was a similar disparity between men and women's death rates during the SARS outbreak in 2003, which was also caused by a strain of coronavirus. The question is, how can such information be leveraged to tackle the outbreak or determine which populations are most in need of a vaccine once one is actually developed? See, that's where they're going to make their billions, going worldwide with a vaccine for the coronavirus. Rizzo doubt that the smoking status will be a direct factor in whether or not someone is vaccinated. Given the difficulty of developing a vaccine during an ongoing outbreak, it's an inevitable supply constraints. High risk populations will likely be prioritized during a vaccination drive. I don't think smoking itself will be a good figure to use, said Rizzo. It's going to be whether these people are impaired on an immune system level. That might mean having an underlying respiratory condition like chronic obstruction pulmonary disease, COPD, or similar ailment, conditions that may well be caused by smoking. Wow. But out of the 2000, they did not say how many of them were smokers. So it's hard to say, but I can kind of agree with what they're saying. Smoking, certainly, because one thing they say about the coronavirus is people have a very difficult time breathing. And I can see if you are a smoker, that can be devastating and deadly, especially if you have a pre-existing lung problems or heart problems. But y'all, please tell me what you think. Please leave your comment and subscribe. Don't forget to hit on the notification bell, and I'll see you on the next video. Peace, family.